Rachel Carson sounded the alarm about threats to our health and the environment posed by toxic chemicals. As members of the Rachel Carson Society, your annual leadership supports the Silent Spring Institute, which keeps her legacy alive by making it possible to continue operating as an independent, world-class research organization. We begin with Dr. Julia Brody, who has been at the helm of Silent Spring for 24 years.
Hi, everyone. It's great to be with you and to see those of you who are willing to turn on your video. The world has certainly changed since we last gathered. And I think every conversation these days with someone you haven't seen for a while starts with, how are you doing? So I'm going to start there and just say that I'm really, truly grateful that Silent Spring staff and families have stayed healthy. And I send my best wishes back to all of you for the same and to make it through this pandemic safely. I'm also really grateful that Silent Spring was so well positioned to respond as an organization, going to remote work, and also as a scientific team contributing to the emerging issues at this moment. We've been able to keep working on data that we have in hand and to keep planning for some great new research that some of which we can launch remotely and some of which we'll have to wait until a future time when we can safely do research in person again. But some of our staff, many of our staff, are juggling Silent Spring work with kids at home and other new responsibilities, and everyone is just doing an amazing job of keeping it all together. But aside from those organizational challenges, I want to reflect on how our science intersects with the COVID pandemic and also with the imperative to do more to address systemic racism. So COVID intersects with our research in several ways. We're learning again in this new context how environmental exposures affect vulnerability to disease. And so first on that score, our scientists are national experts now on PFAS, per and polyfluoroalkyl substances. They're found in stain-resistant and waterproof textiles and other products and in many contaminated drinking water supplies, including on Cape Cod. Silent Spring became interested in PFAS because it affects development of the mammary gland in animal experiments and impairs lactation, increases susceptibility to tumors. But PFAS also depresses immune function and hinders the effectiveness of vaccines. And that's critically relevant now as a potential factor in vulnerability to COVID. So we are seeking funds now to add COVID-related measurements to our PFAS studies so that we could contribute to this aspect of the pandemic. Second, this won't come as any surprise, cleaning, beauty, and food preparation activities are all affected by everyone's responses to COVID. You know, there's maybe more cooking at home, less restaurants, more cleaning, maybe less makeup, and less air pollution. So, and we're very well positioned to study how these practices have changed in ways that may influence chemical exposures, which could have some long-term interest as we return to some kind of new normal. Meanwhile, to help people navigate product choices, we've been sharing tips on social media and added a link to downloadable tip sheets on our website. And we're using our communications to leverage the ways in which the pandemic has changed the awareness of several themes that are central to our core values. People have an entirely new understanding of the idea of prioritizing prevention and supporting communities because collective action is the most effective, and pursuing environmental justice. As we're seeing the tragic interaction of exposures to air pollution and to hormone disruptors that affect risk factors for disease and how they're contributing to higher COVID infection and death rates in low-income communities of color. Silent Spring already has a long-standing commitment to address environmental justice. Our household exposure study in North California was actually featured in the National Institute of Environmental Health Sciences Handbook on Environmental Justice. But we've been reflecting on our current projects and partnerships to look for ways that we can strengthen our contributions to environmental justice and anti-racism. As one example of a current project we hope to expand and build upon, our Taking Stock study in Los Angeles partners with Black Women for Wellness and Promotoras de Salud to support their efforts to learn about products women are using for cleaning and personal care, and find out what alternatives are available at local bodegas and salons, and learn how these products affect personal exposure. This is the groundwork for what we will hope become a science-based program to reduce exposures that may be contributing to disparities in a range of health outcomes, including reproductive health and obesity, as well as cancer. So this has been a very rough time, but we see in these examples of studies that are ongoing and planned, we see even more intensely the value of our work to respond to public health crises, COVID, structural racism, as well as cancer, and contribute to a healthier future. And I thank all of you for joining us in our commitment to do more.
Now it's time to hear from Bethsaida Cardona. She graduated from Harvard College in 2019 and began her work at Silent Spring shortly thereafter as a research assistant. She's here to talk about her research identifying chemicals that target the endocrine system.
Hi, everyone. Today, I want to give you a glimpse into my year-long experience at Silent Spring. I'll begin by sharing with you a preview of a paper that was accepted for publication just yesterday. So, a little background on how this project started. A few years ago, Silent Spring received an inquiry from a resident of Cape Cod who wanted to know the health implications of a herbicide called triclopyr, which was going to be sprayed underneath power lines. When looking into this inquiry, we found that triclopyr caused mammary gland tumors in rodents, but EPA did not use this information when assigning triclopyr a cancer classification. All pesticides receive this cancer classification, which essentially describes the likelihood that a pesticide causes cancer, and the one that triclopyr received was that of a group D carcinogen, meaning that there was not enough information to determine triclopyr's carcinogenicity. That got Silent Spring researchers thinking, was this decision reasonable? And are there any other pesticides whose effects on the mammary gland have been ignored? Because pesticides, in addition to pharmaceuticals, are among the few chemicals that must be tested for potential toxicity before they can be used, we were able to review over 400 EPA pesticide documents that summarize health effects for each pesticide. Using these documents, we identified pesticides for which mammary tumors were reported in rodents, and then further reviewed if this information was considered when determining the pesticide's cancer potential. Through this work, we found 28 pesticides that produce mammary tumors in rodents, but EPA considered only 9 of these in its cancer risk assessment and dismissed the others. Common reasons for dismissing these effects include saying that the tumor was not due to pesticide application, the way by which tumors were formed in rodents was not relevant to humans, or that the effect only occurred at excessively toxic doses. In some cases, there was simply no discussion about why the tumors were dismissed. We also found that while 19 of these 28 pesticides are used in the US, only 6 are approved for use in Europe. Some of these decisions for dismissing mammary gland tumors may reflect an oversimplified view held by toxicologists and regulatory scientists of how chemicals cause breast cancer, one that doesn't consider the effects of endocrine disruption on mammary gland development or tumor formation. And endocrine disruption is essentially another way of saying hormone disruption. For example, in the case of 2 widely used herbicides called IPBC and paraquat, the mammary tumors were dismissed as not due to chemical application because while the lower doses produced mammary tumors, the higher doses did not. And usually, regulators like to see increased effects with increased doses. However, this doesn't consider that when rodents are exposed to a pesticide at a high dose, this can result in weight loss. And this weight loss in turn leads to endocrine disruption that may reduce the formation of tumors. Thus, the condition that regulators have to see increased effects with increased doses may result in effects at lower doses being ignored. Furthermore, using data from tests conducted in cells, we found that about a third of the pesticides that cause mammary tumors in animals increase synthesis of estrogens and progesterones. These are hormones whose effects as breast cancer risk factors have been well documented. Meanwhile, 2/3 were active in associated pathways, for example, by affecting hormone receptors. However, to learn how studies in endocrine disruption conducted in cells translate to studies in animals, it's necessary that regulatory testing look into these effects. However, regulatory testing does not routinely consider effects on endocrine disruption. Testing also does not consider effects on mammary gland development, which has been shown to be a good measurement of endocrine disruption. We hope EPA sees this paper and considers revising its guidelines for assessing mammary gland tumors by incorporating testing that is designed to more completely capture effects on breast cancer biology, like capturing effects on endocrine disruption. Now, incorporating adequate testing leaves gaps in pesticide regulation that essentially ignore effects on the breast and expose people to pesticides that may increase breast cancer risk. In our article about these results, we also specifically call for a reassessment of several pesticides, including triclopyr, the pesticide for which we had received an inquiry. It's interesting to think that before working at Silent Spring, chemical regulation wasn't really on my radar. I assumed all chemicals, not just pesticides and pharmaceuticals, were regulated. I assumed the chemicals found in my personal care products, my cleaning products, and essentially any product I purchased at a store was guaranteed to not be potentially harmful to my health. But as I have learned through projects such as this, there is little information about the effects of these chemicals. And because there's hardly any regulation, it's only after people have been exposed that harmful health effects are sometimes reported in humans, as has been the case with chemicals like flame retardants and PFAS. And it's not just consumers who are exposed to these potentially toxic chemicals. It's also the farm workers who apply pesticides or work with produce with pesticide residue, and farm workers manufacturing products containing these chemicals, workers who already represent some of the most vulnerable populations. We have to do better in regulating chemical exposures and eliminating exposure disparities, which can lead to health disparities, as we have seen with COVID-19. I'm proud of the work that Silent Spring has done in exposing limitations in chemical testing guidelines, in exposing health disparities, and in using data to shape policy. But there is still so much more work left to do. Prior to working at Silent Spring, I didn't know how to approach the intersection between environmental and human health, especially as someone who was planning on going to med school. Now, I'm determined to also incorporate research into my work, research focusing on how environmental disparities lead to disparities in health outcomes and on prevention. I'm still figuring these steps out, but I'm thankful for Silent Spring for guiding me on this path. Thank you.
Now, let's turn to Kathryn Rodgers. She's been with Silent Spring for 8 years. She's a recognized expert in the field of science translation for policymakers in governments, businesses, and community groups. She'll talk about her work this year and the impact your support has helped her and Silent Spring to achieve.
Hi, I'm Kathryn Rodgers, and I'm a scientist at the Silent Spring Institute. My background is in public health, and I joined Silent Spring because I believe that science and data could change the world. I now know that it takes that and a whole lot more to make big changes where they count. I'm going to share with you what I did last year to make sure your support for our research made an impact. Scientific data shows we have a public health crisis with widespread exposures to thousands of harmful, unregulated chemicals. And we know that racism magnifies these effects in environmental justice communities. But business interests make money from these chemicals, so it takes science along with strategy and organizing to make change. Silent Spring has long worked with communities to generate the scientific data that has been used to create change. For example, our research has shown that use of flame retardant chemicals in furniture leads to higher exposures in people. This information in the hands of a small army of very persistent people helped lead California to rewrite their flammability standards so that today, consumers nationwide can buy furniture free of flame retardants. Some of you have heard this before, and I'm updating you, but to recap for those who are new to this subject, flame retardants have been added to foam and furniture to reduce its flammability. While that might sound like a good thing, there are two things you should know. The chemicals often used are toxic, and exposure to flame retardants has been linked with a host of health problems, including cancer, thyroid disease, decreased fertility, and lower IQ. The companies that make these chemicals have been the primary agents advocating for regulations that require their use in furniture. Our most recent work that I want to tell you about was to demonstrate that the furniture standard that relied on flame retardants and foam is directed at solving a smaller problem, open flame fires on foam, while not addressing what is a much bigger problem, which is smoldering cigarettes on furniture. We decided to do this study because the chemical companies that produce flame retardants remain adamant that these toxic chemicals are necessary for saving lives from house fires. In order to set the record straight, last year we published a study showing that the furniture standards that rely on flame retardants do not address the most dangerous types of fires that involve furniture. We analyzed 13 years worth of fire data in Massachusetts, specifically evaluating home fires involving furniture and their ignition sources. Our findings indicate that the deadliest fires were those involving furniture and cigarettes. In this graph, each cell is a fire fatality. The cells are color-coded by ignition sources that started the fire. The cells with hashing are fires that started with upholstered furniture. As you can see, the majority of upholstered furniture fatalities resulted from cigarettes. Yet, flame retardants were added to all upholstered furniture to address the 4 fire fatalities that were started by an open flame. Our study supports the new standard that is designed to prevent furniture fires started by sources like cigarettes, which does not rely on flame retardants and will save more lives while reducing exposures to these harmful chemicals. But, like I said, this information on its own can't bring change unless the right people know about it. So last summer, I accompanied a fellow scientist from the Green Science Policy Institute and an activist from the Consumer Federation of America to meet with the federal agency developing furniture flammability standards, the Consumer Product Safety Commission. We had good meetings with the commissioners, but I soon realized it is the commissioners' technical staff who wield considerable influence in the agency's process. The commissioners follow the staff's technical direction. So I then scheduled a meeting with the right staff members and went back down a couple months later. I did not anticipate that one of the hardest parts of this would be walking up and down a highway in Rockville, Maryland, looking for the entrance to the Consumer Product Safety Commission building. But as a result of that long and in-depth meeting, I was able to show that the data does not support the chemical company's claims. The staff also said I was one of the first public health scientists there to talk about the finer points of the data. And I didn't push an agenda on them, which made our discussions more reasoned and successful. Now, this image is from the children's book Swimmy, and all of these little fish decide to swim together to become the biggest fish in the sea. When we act like Swimmy and her friends, we can accomplish great things. As a result of sharing our data with other scientists and activists, we also shared our findings with Ireland's Furniture Flammability Standard Development Process, recommending that they reduce flame retardant exposures. The chemical companies and their consultants continue to have their own meetings with commissioners and their technical staff, no doubt to advocate for the continued use of flame retardants. So we will need to keep working with our allied scientists and activists to tell the truth to the Consumer Product Safety Commission and other policy-making bodies. But the good news is that states working on their own flame retardant bans are using our study to show that they aren't even addressing the biggest risks. The chemical industry spends millions of dollars on lobbying, campaign ads, and political contributions. It is vital that public health claims power in decisions made by businesses and regulators. We are able to do that with support from generous donors like you. Thank you.
Now to questions from our audience. The first is for Julia. Here it is. You mentioned a project called Taking Stock and your plan to build on what you are currently doing. What would that look like and how can we help?
That's a really exciting project that's in the field now in Los Angeles. And so there are 2 ways we'd love to build on it. One is to bring it also to Boston through our partnership with Resilient Sisterhood Project. We've found in our past research that bringing our research to more than one location can reveal interesting things. For example, when we found the very high flame retardants in California. And the second way we'd like to build on it is that you probably know already that we have a smartphone app called Detox Me that provides easy tips for people to reduce their own exposures. And now in the Taking Stock study, we've built a new app that allows people to scan their products and track what they're using every day. And we want to put these two pieces of work together so that you could scan your products and then scan and track your products, and then get back a report on where your chemical exposures might be coming from and what you could do to take steps to reduce them. It would be really an exciting way to help people get feedback on what they're doing now that's personalized and how they could change it.
The next question is for Bethsaida. Congratulations on your new article. Where will it be published? And can you tell us what steps Silent Spring is taking to make sure it ends up in the hands of the EPA and other policymakers?
Thank you. That's a really good question. This is actually going to be published in the Journal of Molecular and Cellular Endocrinology in a special issue that's focusing on the endocrine disrupting effects of agrochemicals. While the paper is not out yet, as soon as it comes out, we hope to present it at meetings where EPA regulatory science policy is being discussed. We want to collaborate with advocate partners, for example, at the Natural Resources Defense Council, who work on pesticide regulatory issues to maximize its impact. We also plan to petition for EPA to revisit registration decisions for several pesticides, which I highlight a few in the presentation, and also petition for an update on their guidelines for reviewing memory tumors. And then we're also working on a second paper that identifies chemicals that increase estrogen and progesterone and which might increase breast cancer risk. And this also elevates some of the ideas discussed in the paper, such as the importance of better assessing and considering mammary gland effects.
The next question is for Kathryn. It reads, "That's so great that you went to the CPSC. I saw on social media that people are upset about Nancy Beck's nomination. What do you think about that?"
Thanks. That is a good question. And that's correct. The reason why people are upset about Nancy Beck being nominated to lead the Consumer Product Safety Commission is that she used to work at the American Chemistry Council, the chemical industry trade group, and her job there was to shape government regulations in favor of the chemical industry. And more recently at the EPA, she has an EPA appointment and she's blocked a number of bans on hazardous chemicals there. And so the reason why Trump has nominated her to chair the CPSC is because last year, the CPSC voted to move forward with a ban on the entire class of organohalogen flame retardants in most consumer products, which is a huge precedent. Silent Spring testified at the hearing before that vote. We highlighted the benefits of using a class-based approach, which is far more effective than the usual one-at-a-time chemical regulation that leads to a continual regrettable substitution of one toxic chemical for another. Now that the agency is deciding how to go about developing and enforcing the class ban, industry wants their best advocate there for chemicals leading the agency. So in 2 weeks, the US Senate is going to vote on the nomination, and activist organizations around the country are working hard to make sure that she doesn't secure the nomination. And there is a lot of really important news right now. And this might seem small in comparison, but this event is critical because it will have ramifications for public health and safety for years to come because it's a 7-year appointment. Thanks for asking.
Thank you all for being a part of this virtual gathering and for all your great questions and responses. We miss seeing you in person and look forward to being together next year. We are planning a virtual Silent Spring Gala scheduled for October. Reach out to Rachel Sarvey if you want to get involved and join the committee. Thank you for watching, and thanks for the interest you've shown in our research. Your support is changing lives.